How's everybody doing? Hey, I got some suggestions if you've got some shoulder issues while you're working out. I want to say what's up to my cousin Davin. It's good to hear you've been working out, so keep at it. But Davin also has a job where he's seated a lot, and I know most of us do. So what you want to be aware of when you have jobs like that is the tendency for the shoulder to get out of position, and you normally won't encounter any kind of ill effects from that doing most normal things. But when you go to working out, some of those exercises are kind of going to be tough for you because of the position you've been habitually in through your occupation. So want to throw some information out there that's going to stick. I want to try to be concise and succinct about it and address the general things first. And the first of which is, if you've got pain that's feeling like it's not getting any better, or it's waking you up at night, or it's just, you got to make the final decision on that yourself. No one else can help you out on that. If you are just feeling like you should go see someone about it, by all means do so. Stop what you're doing. But if you feel like it's you've kind of experienced it before, and it's just been a long time since it's happened, and maybe you weren't trying to work out at that point, then maybe you try some of this stuff and you go into it gradually. None of this stuff is going to be anywhere near one rep max territory or anywhere near 100% intensity. You want to, in fact, we're trying to make these kind of minute adjustments that are targeting these stabilizer muscle groups that should be taut and contracted when you're going to make these compound movements. So what you want to be aware of is a lot of things happening actually, and this is going to be information laden, but like I say, I'm going to try to be succinct about it. What you got to address is, and we got to talk about shoulder blades. So what's happening to your shoulder blades are, if you think of your shoulder blades as being the palms of my hand, and they're going to position themselves around your rib cage in the back. So what's happening is they're starting to go up, so they're elevating, and your shoulders can elevate and they'll also upward rotate. And so I'd say some of that's happening too, especially if your elbows are up here and you're typing. So be aware of that. So your shoulders can elevate and they can upwardly rotate, as well as downwardly rotate too, and depress. But we're focusing on getting you out of elevation, so we're going to focus on depression and downward rotation. We're also going to be focusing on another thing, is this inward rotation to the AC joint, the acromioclavicular. And what we got to do is start tightening the muscles in between those shoulder blades and get some retraction. Yeah, some retraction. So we got to get that going on, and that's what you'll probably want to start your more resistance exercises with, something involved with a row, and make sure you're real diligent on following through with form, and I'm going to give you some cues on that and some stuff to watch out for. But there's a lot going on, and there's a lot of torsion in that shoulder, and one of which is the lat muscle. And the lat muscle is down here around the thoracolumbar area, and it'll wrap around and actually attach in front of your humerus. So what you got to do is create some space here, but always kind of making sure that's happening, because this is real cramped and there's a lot of stuff happening here. There's a lot of network, so you have to be aware of any kind of usually they'll be brought out in like your impingement test. If you're here and you experience pain there, then you've probably got some kind of impingement going on, whether that's a tendon or a nerve impingement. So you should see a physical therapist or a doctor or someone who can tell you exactly what's going on. But all of that is usually happening because it's real cramped here. So the general idea is to give yourself some space here. So we're going to address that. But all of that, again, with the shoulder blades, we're going to be involved with some retraction. Oh, and we're talking about the lats. So that's tight, and it's really drawing that shoulder inward. So we got to get some space there. We're going to stress the lats out. Okay, so first of which, let's go with the lats, because that one is real neglected as far as culprits in what is getting you in your position of that forward rounded shoulder posture. I usually do this with a Swiss ball. You can use a couch or an ottoman, whatever is handy. And you know, you want to be real specific about this. You want to get in this quadruped position. That ain't happening. So you want to start off here. And believe it or not, your tendency is probably, you won't even notice you're doing this, but your tendency is probably going to look like this somewhat. Because you're here most of the time. And so you will get out of that, and one of the ways you do that is go thumbs up when we're stretching this area here, and you want to kind of go towards stacking the shoulders here. So by virtue of keeping an outstretched elbow and most of my weight through that outstretched arm into the ground, through the bottom of my palm, and then keeping, you know, I'll start off here with my shoulders square, and then I'm going to rotate toward the wall, and I'm going to keep my chest directed toward that wall as much as I can, right there. Now, it's not uncommon that if you are dealing with some irritation and you go to stretch that affected side, that might not bother you, but when you go to stretch the other side, that might be feeling pretty good. That impingement might show up when you rotate in. So you'll see what I'm saying. Well, let's say my right shoulder was the one affected. When I go here and I go this way, you can see how my trunk will dip into that shoulder. And that might provide yourself some discomfort, and so you kind of want to gingerly go into that posture. With that one, that's going to be a timed hold, and you just want to feel your lats stretching underneath that armpit. So we're going for the outstretched arm to armpit. That lat muscle should be pretty tight. You want to spend some time here allowing that muscle to release. So you want to live here for a little bit, get you some hard candy, some hardtack, some bacon, camp out. And it should feel good, man. I mean, for real, you should get a lot of relief out of this if you're prone to sitting at a desk most of the day. Okay, so that should do a large part as far as, you know, stretching your lats, but we need to strengthen that side of the body more, so we're not going to spend a lot of time there. We're going to then spend some time with these pull aparts, and this is a good exercise to hit those rhomboids, the muscles in between the shoulder blades that are responsible for retraction. That means getting the borders together in between shoulder blades. So we're going here. We're creating a crease, an indention along the inside border of those shoulder blades by going into retraction. And so what we want to do is do what we call pull aparts, and this is a real effective one because it doesn't take a lot of feedback to let you know that you're doing this right. We don't have to have a mirror. We can just remember a few things, one of which is, and this is going to travel down the kinetic chain, and hopefully we get some other ancillary benefits out of this one, not just shoulder and back, but also wrists, elbows, stuff like that. Now, I've got a band here, but it's 80 pounds. And again, we don't want to be anywhere near our 1 rep max intensity on this stuff. This should just waken up those dormant muscles that we're not used to using because our brains are quicker than our bodies. And see, here I am grabbing for that bacon, and I haven't given myself time to move correctly. So that's what you want to go for. This won't be as thoughtful once you get used to moving this way, and that at least that's the idea. And I've seen it happen. It's happened to me. I'll move this up a little bit. So don't get thinking that this is going to be a very tedious thing. You're like, man, I gotta do this with everything. I think there might be a time where it feels like that, but this translates quick. Pull aparts. We're here. Let's go straight wrist. And what I mean by that is we want to be able to stay right there, knuckles forward and not here. or especially not here. So we want to keep that right in the middle. And then the elbows should be locked out throughout this move. And you might start the movement with the hands, but you're going to finish with the shoulder blades. What I mean by that is once you've reached the limit, because that band's going to limit how far you can go back. Once you kind of hit that chest, and you can keep on going farther back, that's what I mean. But also, you can kind of develop that internal tension. Once you've kind of reached the end of that range of motion, then internally you can use that band to kind of push apart even more and get some more contraction there. A good 10 here done thoroughly at a good moderate tempo with the shoulders down. And that's another thing. We got to keep the shoulders and the ears far apart through most of these movements and throughout the rest of how we move as much as we can. That's a good principle to remember. You can't really go out getting yourself a bad way by keeping this down. You get yourself in a bad position when they go up. And we'll talk a little bit about that later. But we've done those pull parts, so that's going to help those rhomboids wake up. We've stretched the lats. Now we're going to get into the minutia of what might be going on. Again, don't want to say this is going to fix what is going to fix your problem, but when the majority of the workforce is now in these seated occupations, it's funny how much things start to become familiar. Hey, why is this in this routine for this? Well, there's a host of issues that come with working at a desk, and it really can be thought of as the new smoking. And that's why you need to take breaks, not just because of what we're talking about with the postural health, but how indicative this is of how you can't divorce the mind from the body. I mean, you're sitting there thinking, but your body is gradually getting into this flexion that we need to work our way out of. So, there's a lot wrong going here, but there's a lot of opportunity to look and see, wow, there's a lot going on here we didn't think of previously. So take those breaks at least on the hour, because what else is happening, not only posturally, but your eyes are getting sore, they're getting strained, and you start doing this and you get closer to the screen. And let me tell you something, I just was reading this the other day. That atlas joint, the very top vertebra, if those ears are over the shoulders like they should be, that's going to be about 15 pounds of pressure on that joint, which is already pretty good. But man, the more forward that head goes, the more PSI goes up right there at that critical junction, the very top of that vertebra. And we're talking about 60 pounds right here. It might feel familiar and it might feel right to position yourself this way, but that's just habit, man. And that just tells you how habitual we are as a species, really. I mean, we don't even think about it. We're doing more work and thinking it's right. We don't question it, but we're actually exerting ourselves by staying in that position. So we want to work away from that kind of shoulder forward position with eye strain. It's going to translate to headaches too, so make sure you're taking those breaks. What we're going to do next is these, I call them external rotations, and you'll see these done maybe a slightly different way than what I'm going to show you. It's not wrong. I just get used to teaching it this way. I'm using a band here, and you'll see this. You can use a weight stack as well, but you're again not getting anywhere near the intensity you want to go for when you're getting into the 6 rep and lower ranges with your more general multi-compound movements. But with this external rotation, I really, this is on the Mount Rushmore of shoulder corrective exercises as an exercise. So it really performs well. Usually, it's been my experience. You want to get yourself a band or a cable attached to a weight stack, and you want to get yourself positioned where we're looking to, I want you to picture this bone here, this humerus. We're going to twist that bone outward. We're going to externally rotate it. And I use as a guide or as a reference point that inside arm against that torso. I don't want to apply any pressure there to assist in the movement because it shouldn't be that intense. I just want to make sure it's there. It lets me know that I'm not chicken winging it. I'm not out here and it's staying vertical relative to my anchor point, which is just above waist height, right here. So all those things being covered, we also want to keep space here, and we're going 12 o'clock to maybe 2. Any more than that, I know I'm going to start compensating with my hip there. So again, you start doing 10 of these to start with and end up going 15, and then keep on going up with that tension, and hopefully we're working that rotator muscle group, which is responsible for keeping that humerus down when we reach overhead, so we keep that clearance. Again, 10 to 15 here on these external rotations are going to treat you well, and this would probably be towards the end of your warm-up as far as where I would place that exercise. You'll do both sides. I don't care if one shoulder's hurting. It's good to kind of just keep this going and this mindset going. And I would, again, I'd put these in the warm-up, or if you're doing like supersets or circuits and you've got some downtime in between those, you can use these as maybe an active rest. You can kind of get recovery in and knock out some of these less intense movements. Okay, so we're going right into it, and what I want to do next is integrate a lot of neck rotation with that shoulder. And what I found is the T-dog works well with this. And we've been in this position before with the lat stretch, except instead of having our arm and hand on that ball, it's going to be against or wrapped around the back of the head, and we're going to open up. So again, if that affected shoulder is the down supporting arm, you might have some impingement, some irritation there, and I would gradually go into that position. You just want to be aware of that. So right here, this is your T-dog, thoracic dog right here. So we're in this quadruped position, and we're going to wrap our right hand around the back of our head, and we're going to open up here. Our eyes are following our elbow. That's critical. And then we're going to reverse. And we might even sink a little bit right there. And then open back up. It's real critical to keep your eyes on that elbow, because where the eyes go, the body follows. And that's so true, and you can really get a lot out of that just one phrase. I mean, if you're down here, because a lot of times you can get some extra tension there, and you can use some of that to your benefit, but man, the overall effect of that is just we're going in the wrong direction. Get that tension. We can probably get that tension going in the opposite direction a lot of times, and get ourselves out of a bad way. So on those T-dogs, I'd knock out 10 aside. I think we're probably doing pretty good there. We can work up to 10 or 20 or 15 to 20 on each side right there. But, you know, late part of the warm-up, we don't want to spend a lot of time warming up. But, you know, the nature of most of these shoulder issues are if you don't give it a chance to at least get out of that congested, cramped area here by moving it this way and less pressing for at least a few weeks, then it's never going to get better. And you just need to let that inflammation work itself out. You can assist yourself in that way by icing it and doing some things. And I know it's just tedious, but it does do a good thing, you know. So be aware of icing, you know, take those anti-inflammatories if you're prone to. I'm not condoning doing it. I'm not saying I do or don't. But, you know, that's an option usually. Another thing we want to work on is a lot of times we get caught in opposing muscle groups just being, you know, anterior and posterior, and they can also be elevation and depression. Like I talked about with the shoulder blades, you've got the ability to elevate and depress. So a lot of times we'll see elevation here where we're in that fight or flight, and then we'll see depression here where, you know, a lot of times I don't see this a lot unless I actively go down. But, you know, you'll see some people have that really good posture and they're just walking around like this, acting all snooty. That's where we want to be. You know, that's just less tension. If we have ourselves aligned right, that's less tension, less exertion overall. And it just helps us out. So we want to work in that space, and we want to get in some prone Y's, T's, and W's. And just by virtue of being in that kind of, for lack of a better term, cobra position, you're in a prone position, face down, but your chest should be off the ground. So we talk about that forward around the shoulder posture being here, our T-spine's inflection here, and we want to work ourselves out of it and also address issues with the shoulder. Well, we got to start off on a good base, so we're going to be in this extension, and then we're going to work on some shoulder stuff right here. So we're going to be face down, and we're going to start off with the arms in a Y, and the arm should never, in any of this stuff, except for the external rotation, be in any kind of flexion. You know, we're addressing stuff with the shoulders and, you know, the neck area, all this stuff. So, well, you want to make sure that, you know, you're not in a bad spot, okay? And also, there's a lot of integration with a lot of stuff, so we've got to check those boxes off. And if you're doing stuff with flexion with the arm, then we're not helping ourselves out. It's not just about getting from point A to point B. Even with this kind of stuff, form is most critical. So keep the arms outstretched. It's not just about going from point A to point B. If I go from point A to point B here, I'm not working anything with the shoulders, I'm working my back. So keep the arms outstretched throughout, and that's going to keep the work where it should. So we're in this prone position. Are you going to get rid of Chris? Yeah, I promise. So here we are. And, you know, we want to be in this extension here with a T-spine. And then we're going to go for 10 Y's and then 10 T's. And keep the thumbs up throughout these. And then we're going to go into W's. You notice I got kind of a pull here. I sometimes add that too, except I do that on a foam roller. We'll align my spine on a foam roller. And I'll go here. Now I don't want to go too much arch back here, but I do want to keep that natural S-curve. Okay, now if you go through 10 to 15 of each of those variations, you should be working a pretty good heart rate, exertion level on that warm up again. And again, you can throw these in between supersets and circuits. All right. Okay, so we're going to describe a couple more. Okay, now this one, I've never heard anybody in the gym, you know, like episodic, and that's not like a point of pride or anything. I've just been lucky. But I have on this one move, and it's load bearing, and it's fairly innocuous and innocent looking at it, but okay, so we're here, and what happened was hard pop doing this one. So go into this one gradual if you've had any kind of shoulder dislocations, and if the shoulder's already just a tricky area for you, you've probably been versed on this one, and because this one is this is another Mount Rushmore type for like any kind of shoulder correctives. And this one's called a wall slide. And I've got a very little wall here to work with, so we might have to use our imagination and just imagine there's a flat wall to the left of me and to the right. You can't see that, but let me go here. So what we're doing here is, and the camera's not on my feet, but I can describe what I think we should be at. Most of the stuff that's taking place is we want to orient ourselves for the back of our head, the T-spine, and the sacrum are all making contact with the wall. All right, we'll start off here. And again, we also want to make sure back of the hand and the back of the elbow area are making contact with the wall. We eventually want to get here without an arched back. I'm still using a little compensation here because I don't have the best posture. I'm trying to work on that. But you want to make sure that you keep the ribs from flaring out like that. You want to keep them tucked. So we're here as much as we can. I've heard also more expletives, people doing this exercise than any other. But try not to get frustrated. This is going to surprise you on how, maybe not good at this you are. But you want to eventually go into a Y. Raise the shoulders here because you're probably prone to this and we need to work our way out of it. Sometimes we get out of it by doing that and then reversing that. So then I drive it down and then I keep those points of contact and then I want to try to drive my elbows to my torso, and after that we don't have anything else to work with. You might get some cramping through here, but like I say, I haven't really had too many issues with this one, and it's fairly common. It was just, I thought it was kind of ironic that someone got hurt on one of these moves, and it was my fault because he shouldn't have been doing them, but lesson learned. Anyway, wall angels, wall slides are good for you. Do them. I wouldn't go more than 10 or 15, and probably like you just saw with me, really spending some time on trying to reach those reference points. Like I should keep my ribs more tucked in on that one. So I need to work on that. And I think 10 done really, really well with that in mind is going to be better than 2 sets of 10 or a set of 30 or 2 sets of 15, 3 sets of 10 done sloppily. So spend some quality time on those. And we are wrapping up here with the row. And one thing about the row is we start to work into that more general progressive resistance that you should be accustomed to if you've been working out. If you're new to a program, you would want to put this move toward the beginning of your working out, because if you go in there and you're feeling good about it but still somewhat vague, and it's one of your first few times back since having an injury, or you wanted to get back into it and try out, then maybe a lot of your workout changes on what you can do here. And I tell you what, you're a good person if you do experience something and you make that adjustment, and A, not only get a workout in, but B, don't feel compelled that you're missing out on anything by giving that a rest, because you can double up on anything else and still get that intensity that you're looking for. You just want to take care of the stuff that you should be thinking about at the beginning while you have most of your attention still in reserve, or what work hasn't taken out of you. So what we want to do here is rows, and we want to make sure that we're using really good form here, because this is most of it is arm action, but it's a back exercise, and you really want to focus on moving that shoulder blade back toward the spine and getting yourself out of some of these positions that I'm going to talk about, and one of which is you want to make sure that shoulder's not elevating. And the reason why it does that is you can get some tension there and kind of have more of a stable base from which to pull, but you don't want to go there because that's already really, really tight and contributing to this kind of forward rounded posture. So we want to be here and we want to pull and flex that elbow as that shoulder blade moves toward the spine. So that creates space here too as well, so that's good. And we're working probably more at the beginning of your progressively overloaded strength routine, so you probably want to go, working at 8 to 12 hypertrophy range. If you got shoulder issues, I wouldn't think you were going too much lower than 8 reps a set. And if you are, I've got some thoughts about that, and I'll probably post them up if it seems to be an issue, but this is a really general video for anybody having some undue shoulder issues. Okay, so on that row, again, I kind of got caught on this one, mid-sentence, mid-thought. So usually what I like to do is start with a high anchor point, and just by virtue of having that high anchor point, it's going to set my humerus. And just imagine I'm holding the handle and not this band, I'd be right here. But for purposes of this video, What that does is it sets my humeral head down in that socket like it should. If it's anchored lower, you see where that force vector is going? It's going back and up. Now the back is good, but the up is the way we want to stay away from. So the high anchor point assists in that, and that's why I usually start people off with a banded row when they feel good and ready to get some work in. And sometimes that shoulder impingement won't affect this. Usually it will affect a lot of pushing, whether that's forward or overhead. So you would be wise to cut those out at least with any kind of shoulder issue. Stop your push-up, stop your bench press, stop these, the upright row. Let's address these real quick. This is not getting you out of any kind of shoulder impingement, it's contributing. As are these. Don't quote me on that, but I would definitely not start any kind of shoulder issue with those. If you've seen anybody do those before with any kind of shoulder issue, they're probably going thumbs up and they have their own reasons and it's contextual. So not saying any of these kind of general movements are bad with people with shoulder issues. It's just been, you don't want to err on that side, and that's a little bit more intense. So that might be on down the road. Stop doing these for sure. And then, you know, lay off the bench and the overhead for a few sessions and see how some of this stuff, like I say, you can always double up on the back. We're always in front of ourselves a lot of times, so we want to kind of work more on strengthening that side. So another thing with your row is shoulder stays down. Breathing and the mechanics of your breathing have a lot to do with this posture here too. So you're always, chances are you're probably working in a little bit of oxygen deficit as far as your blood goes and the oxygenation in it. And it's not because you can't mechanically get into those deeper reservoirs in your lungs. It's because you can't get rid of the CO2 in them or the stuff ready to go out, the oxygen ready to go out. So bear in mind, and I don't have any good answers on that, I probably use some wrong terminology, but the mechanics of your breathing really, usually, generally are faulty. And it's not an overnight fix, but be aware of your breathing on this exercise. Breathe out when you're pulling toward yourself. Keep the shoulders down, move the shoulder blade toward the spine as the elbow flexes, and then release and breathe in. And your cadence on this should be real moderate. You know, you should really go for a good muscle-mind connection here and spend some time here and then release. Like I might go, you know, once I've kind of reset range of motion, I might still have some air in my lungs. I want to expel that and then go eccentric. Then repeat the process. Like I say, you might be starting off, you should start off your routine with something shoulder oriented to address how you're feeling that day and go from there. Now that takes care of most of this stuff. If you got any questions, drop me an email. And just, I think as a general rule of thumb, go gradual into any of these. See a doctor if you think you should, and keep fun into it. It's very, very important that you stay moving, especially when you're injured with anything. Don't get discouraged. You know as well as I do, outside out of mind too. So it cuts both ways. If you don't know exactly what's going on, you know, it's just a time judgment call on that. Do your best on that one, and let me know if you got anything, any questions. Be good to yourselves. Just be good, kids. Come on.